Thanks, Yvonne, for having me back. And it's a great question. I think it's worth 30 seconds to pause how we got here. And it's clearly because we haven't spent enough time worrying about vaccination programs in our rush to worry about vaccines. We haven't worried enough about syringes, about healthcare workers, and about how we can ensure that countries have capacity to produce vaccines. But it's quite clear that Omicron spreads much, much more quickly than previous variants, than Delta and any of the other variants. But it's still too early to tell whether it is more deadly. Some early work by colleagues in Hong Kong and other places have shown that that Omicron can replicate up to 70 times more quickly in airway passages. But once it gets to the lungs, it may replicate less quickly, maybe even 10 times less quickly. So that might explain some of the early results we've seen about it spreading more quickly, but being slightly milder. But still too early to tell. There's much more data needed.
And does Omicron produce different symptoms at all compared to Delta? Can you tell if you've got Omicron just by how you're feeling?
Unfortunately not. It's very similar in most patients. And there's going to be a lot of clinical studies that will be done going on from this for years, looking at some of the anomalous symptoms that people get. But it's very similar to other variants, and also very similar to the common cold. So difficult to tell immediately. The one positive that we have seen is that because of the host of variations in Omicron, it is detectable with PCR tests. So we have been able to get a jump on counting the number of Omicron cases around the world.
What are the most effective measures to combat Omicron in particular? Do you think governments should return to harsher measures?
Well, you've seen some of that across a number of countries, and you were talking about it earlier, Thailand, South Korea, but then also in Europe, the Netherlands, other countries moving to what are termed lockdowns. They are very blunt instruments and really sort of the tool of last resort in some cases. I think what we've learned in this most recent wave, and the difference between last year and this year, we should remember we're almost at the same number of cases weekly that we were at the start of last winter, is that everything can be done safely. We need to think of a different definition, perhaps, of essential activities. If you can manage the number of people in a given space, the ventilation that's there, and be able to check people's vaccination status and their COVID status before you hold a given event.
And importantly, because of Omicron, we're seeing the syringe shortage worsen significantly, as you mentioned before.
Well, this is something that, again, coming back to what I started with, we haven't talked enough about. There's a big rush at producing vaccines and trying to get vaccines out there. Actually, we still have an issue, and my colleagues at WHO are working hard on vaccine equity issues and trying to make sure that vaccine doses get to countries. But in fact, many countries around the world have asked COVAX and other partners to slow their deliveries because there hasn't been enough investment in vaccination programs and the pieces that uphold them. So what are those? Syringe shortages are a big piece. The WHO and UNICEF estimated just recently that we could be 2 billion syringes short at the through the vaccination program into next year. But that actually did not take into account boosters that we were going to need for Delta. Now with Omicron, it's quite clear there will be another round of boosters needed. So with boosters for Delta, we were probably 5 billion syringes short. Now we could be as many as 8 to 9 billion syringes short. And it's a capacity that is difficult to ramp up. Everyone is operating at the highest capacity they can right now from when you talk to suppliers. So this will be a big slowdown for the global vaccination effort.
And will we ever get ahead of this pandemic? What are your recommendations to eventually get there?
Well, it's credit to the world and the team for talking about some of these issues about vaccination programs, and that's clearly going to be one piece of it. We need to do a better job, not just on new vaccines. There are over 370 vaccines in the pipeline for approval with WHO and global regulators. We will have enough vaccine doses. We need to invest in more capacity on syringes, We need to invest on healthcare workforce for vaccination programs and looking at involving community health workers actually in vaccinating people around the world. And then finally, we really need to look more seriously about local manufacturing. There's been a lot of talk about local manufacturing as the magic wand that'll get us out of this pandemic and save us for future pandemics, but not enough of concrete investment on fill finish in countries that are most affected by COVID and will definitely be most affected by future variants and also future pandemics. Those would be my three that I would pick.
So just finally, how long is this all going to take? Based on the information that we have, is it possible to tell how much more we have to endure in this pandemic?
Well, I think on one of the shows that we had in the summer when I was actually in my office, Geneva is not having people in their offices. I said, we can have me back and I can refute everything I've said. So I'll do it again. I'm going to say something and I'll have to refute. And why? Because Delta came and then we reset again with Omicron. So the issue we have is to control the spread in countries that have low vaccination rates and high levels of immunocompromised patients. Those two combinations are breeding a lot of new variants. But we have with diseases the issue of eradication, elimination, control. We've only ever eradicated one disease. We have managed in some countries to eliminate things like polio, measles, et cetera. Both of those are off the table for COVID. We will be living with this disease for some time, but we can manage a level of control that allows us to go about our normal lives, that doesn't have people in hospitals and healthcare systems overwhelmed. And that will be after this winter into next year when we get higher levels of vaccination.
Okay, well, some words of hope there. Dr. Edward Kelly, always good to talk. Thank you so much.
Thank you so much, Yvonne.